Tamaki Makaurau, Auckland, New Zealand's biggest city, with more than 1.6 million people. But have you ever wondered just how healthy we are as a city? Healthy Auckland Together has just released its 4th annual report into the health of Aucklanders. It's called the HAT Scorecard. The report looks at how Auckland adults and children are doing when it comes to obesity, nutrition and physical activity. Dr. Michael Hale talks about the report's findings and what they mean.
I'm Dr. Michael Hale. I'm a public health doctor for Auckland Regional Public Health Service, a member of Healthy Auckland Together.
We've seen the rate of adult obesity triple in the course of a generation. And concerningly, this is affecting children too. The rate of children's obesity is now 15%. Affecting all of us right across the lifespan, this points to something in our environment that's affecting us all and causing us to put on weight. Yeah, well, where you live is key. People living in poorer suburbs have 2.7 times the rate of obesity than others. For children, it's the same. 26% of children who are in the poorer areas, as compared to 3% in the richer areas, are obese. And this travels into other health issues as well. When we look at the rate of dental decay in children, those in the most deprived areas have 10 times the rates of those children in the wealthy areas. So we can really see an environmental influence in that as well. Obesity is one of the leading causes of ill health in New Zealand. It leads to cardiovascular disease, depression, some cancers. Obesity is really important from a societal cost perspective. We know that to the healthcare and society, it's in the vicinity of $800 million a year what we spend on obesity. Yeah, it's particularly important for children. We know that both weight gain is set early on in life and that trajectory continues. And we also know that tastes and preferences are set at that time too. This is why food and drink companies deliberately target our children to try and set those tastes for unhealthy products that they'll be then hooked on for the rest of their lives. We know, for example, that the average child sees 27 ads for unhealthy food in a given day. What we eat is really determined by our income, what's around us in our neighbourhoods, what's marketed to us and our children, and too often it's sugary, low nutrition choices that are presented to us at every turn. Well, there's work to do here too. Less than half of adult Aucklanders are getting the required amount of physical activity per week. And we're missing a lot of opportunities to get good exercise in. We know that kids taking active means to get to school, whether that's biking or scootering, that's decreased across the Auckland region. And adult Aucklanders spend over 6 working weeks a year in a car. That's plenty of opportunity that could have been used to be physically active if other options were available. Well, we've seen a good start in children or preschool children's levels of obesity. And particularly pleasing is how there's been a reduction in the gaps between ethnicities. Pacific children over the last 5 years have seen obesity rates fall by 11%, and over the same time, Māori children have seen their rates fall by 9%. And so that's seen the levels of obesity in the population come to a more even playing field. But there's a long way to go, and what we need to see is the current rate of Pacific obesity at 35% and Māori rates at 22% continue to fall at that speed and faster if we're to see true health equity. Yes, we have joined a number of other countries that have seen the preschool obesity rate fall, and that's very encouraging. But what is it we haven't nailed yet is that once the children get into the school environment and beyond, we're not seeing that obesity decline maintained, but we're seeing it join the adult rates and slowly increasing. So something is happening outside of that preschool environment, that young environment. It's pointing to the fact that parents have less control and that children are more vulnerable to the market forces, to the overarching system and environment that they face. The older they get, the more at the whims of that environment they are. So despite all this evidence that children are being targeted and that everywhere we turn there's an abundance of unhealthy food provision and marketing, there's no law that protects children from junk food marketing. It's very much like we've got our hands off and the industry has their hands on our children.
We need to significantly improve the food environment for all of us, but especially for our children. We could do that by introducing government regulation of junk food advertising. Government regulation could close the current loopholes, including ensuring there are regulations on television junk food advertising during children's peak viewing times, not just during children's programming. Unhealthy food and drink sponsorships of children's sports and clubs becomes a thing of the past. Packaging, promotions and giveaways can no longer sit outside the regulations, and meaningful financial penalties or other robust sanctions exist for those that flout the law.
Well, I think we need to look at those places we eat food in our day-to-day lives and what are the default options available there. So this is where we work, this is at schools, this is sports, clubs and events. We need to have good, healthy options just readily available so that those treat options are found far less and that they actually become treats again.
Head on over to the Healthy Auckland Together website, where you can download the full Healthy Auckland scorecard and check out some of the work Healthy Auckland Together partners are already doing to help make Auckland a healthier city.